Good afternoon, Chair and members. First, I want to begin by thanking our chairman and also the committee staff for working with us over the last several weeks with our office to refine the bill that is before you today. Your patience and cooperation through the process is greatly recognized and appreciated, so very grateful for all of the help. For those of you that don't know, on December 22nd, 2022, which was less than 3 weeks from the day I was sworn in to represent the constituents of Assembly District 27, I learned of Madera Community Hospital's intention to close. Since that day, I've had countless meetings, briefings, and discussions with local, state, and federal leaders to try and find a solution, both short-term and long-term, to ensure continued access to care in the Central Valley. The recent closure of Madera Community Hospital is a devastating healthcare crisis for the people, not just of Madera, but the surrounding neighboring rural communities. Since the hospital's closure, Madera County has declared a local emergency due to the unprecedented impacts brought on by a community without a hospital. Fresno County followed suit with its own declaration of emergency because Fresno area hospitals are feeling the impacts of the closure as Madera community members seek health care across county lines. The reality today is that we find ourselves in a situation where over 160,000 people in the heart of California are without access to emergency health care services, labor and delivery services, surgery, and specialty care in their own home county. Over 80% of people who sought care at Madera Community Hospital were Medi-Cal and Medicare patients, including patients who visited the hospital's rural health clinics in Chowchilla and Mendota, who are also now closed. These patients are mostly farm workers, low-income working people, and essential workers. Some patients even rode their bicycles and walked on foot to the hospital to seek care. Where do they go now? For those without reliable transportation, this is a matter of life and death, and we all know minutes can make a difference. In a wealthy state such as California, where we champion healthcare equity and declare healthcare a human right, we must ask ourselves, how did we get to this point? And most importantly, what will happen to communities in the Central Valley if we have another pandemic? Where will people go? This past weekend, myself and a few legislative colleagues, including the chairman, had the opportunity to visit Madera Community Hospital. What we saw was tragic. We toured a hospital with 106 empty beds, 16 empty ER beds, and 10 empty ICU beds. We stood in an empty labor and delivery room. We walked by an idle state-of-the-art CT scanner room, and we saw hospital equipment draped in plastic sheathing and unplugged, unused, and collecting dust. Empty, no employees, no nurses, no doctors, and more importantly, no patients. The closure has exacerbated the healthcare crisis that we face in our Central Valley. Out of the crisis, we must seize the opportunity for local, state, and federal leaders to stand alongside the community and find a way for the people of Madera to regain access to life-saving and preventative health care. The closure of Madera Community Hospital represents an opportunity for us to think outside the box and demand that we not do business as usual from here in Sacramento. There must be a recognition that there are significant distinctions between urban and rural California, and that the solution will not be a one-size-fits-all approach. AB 412, which is in front of you, is an effort to provide immediate financial assistance to hospitals like Madera Community Hospital that have already closed but are trying to reopen, and also to provide a lifeline to hospitals teetering on the edge of closing. While Madera Community Hospital is the first hospital to shut down post the COVID pandemic, unfortunately, it may not be the last, but we have the opportunity today to make a difference. Other hospitals around the state have signaled their threat of closure, including another hospital in the Central Valley, Korea Health Medical Center in Visalia, El Centro Regional Medical Center in Imperial County. These are some of the most disadvantaged and already impacted communities that lack adequate healthcare services and doctors. AB 412 is simply a short-term solution that will help Madeira reopen and be a lifeline for hospitals that are teetering. I look forward to working with all of you so that there are no more closures that happen on our watch. Today, I respectfully ask for your aye vote.
Thank you. Witnesses in support. You have 2 witnesses that can speak for 3 minutes apiece.
Good afternoon, Mr. Chair and the members of the committee. Thank you very much for allowing me to speak today, and thank you, Assemblywoman Soria, for your leadership on this issue. My name is Muhammad Ashraf. I'm a board-certified cardiologist who has been practicing in Madeira County for 42 years. Since I was recruited by Madeira Community Hospital when I was finishing my fellowship at Texas Heart Institute. Madeira County is a rural, medically underserved county. Most of our 160,000 people belong to minority groups and many are low income. In December 2022, as the Assemblywoman mentioned, because it had run out of funding and because a buyer withdrew its offer at the 11th hour, Madeira Community Hospital abruptly closed its doors, leaving the county without any adult hospital. The issues that plagued our hospital, including COVID, low Medicare and Medicare reimbursement, and poor management are very obvious. I also think you understand the negative impacts and the lack of health care has on a community and on efforts to achieve a just and equitable society. Health is very important to maintain a healthy society. Today I wanted to share what I'm seeing on the ground. My patients are terrified and they're going to die because they do not have the resources, whether that to be a ride, time off, or money to seek medical treatment at the next closest hospital, which is over 35 minutes away in Fresno. I've lost multiple patients myself, and I believe they could have been, they've been living today had Madeira Community Hospital been open and provided timely life-saving emergency treatment. A few weeks ago, a patient having chest pain did not understand what to do and where is the health care available, drove herself to my office for help. I called the ambulance. She survived the trip to Fresno Hospital, but died soon after at home. To add insult to injury, the Fresno Hospital was so overwhelmed that it took days to get me what I needed to be able to sign a death certificate, thus delaying her burial. We need a robust, comprehensive solution to the healthcare crisis. But in the meantime, we also need emergency programs like what's envisioned in AB 412. If such emergency funds had been available to our hospital in December, we could have kept its doors open and saved lives. I urge you to vote in favor of AB 412. I've been in this town for 42 years. This is my only practice. And I sit next to the hospital. I see my hospital empty parking lot every single day. So it's not easy for me or for my patients. And thank you for the opportunity to speak today. I will turn it over to my colleague, Dr. Ali Rashidian, who will also speak for the remainder of my time.